Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we'll be talking to two academicians and they'll be focusing on behavioral modification in respect to pre-diabetes and what is needed for building capacity. And my guests today will be Dr. Karen Davison and Vidhi Thakkar. So, as both of them spoke at the CINI conference, and today we'll be learning from them about what all we ought to know as far as diabetes is concerned and what ought we should do so that we can challenge this particular disease. So let's welcome both our guests and continue with our discussion. Dr. Karen and Vidhi Thakkar, welcome to the program.
Thank you very much. It's great to be here.
Thank you. So I'd like to start off with Dr. Karen, but before that, just a short introduction about Dr. Karen Davison is that she's an award-winning scholar who is currently the Director of Nutrition Informatics Research Group and Health Sciences Program faculty member at Kwantlen Polytechnic University. Her research interests are aimed at food and nutrition practices, interventions, and policies that will foster physical, mental, and cognitive health of diverse populations. She was recently appointed to Health Canada's Nutrition Science Advisory Committee, and she has co-authored more than 400 scientific and professional publications, which have featured across more than 50 international media outlets, including the ABC, CTV, and MSN News. Dr. Karen, once again, thank you for your time, and we would like to know from you today about the topic that you talked at the CINI conference.
Yes, thank you. So we talked about pre-diabetes, and to give you a little bit of information about what that condition is, it is what people would be diagnosed if their blood glucose levels are slightly elevated and that it's not the blood glucose levels are not high enough to be termed as type 2 diabetes. So pre-diabetes is often a precursor to the development of type 2 diabetes. And we are recognizing now within Canada that there is a large proportion of people that have pre-diabetes. They don't realize it. And why it is such an issue is that if you have pre-diabetes, you can actually reverse the condition by doing behavior modification around lifestyle factors to help prevent the progression to type 2 diabetes and some of the complications that might happen from that condition.
Right. So, Dr. Karen, as we would like to know in elaborate terms from you as to you are an expert in this field. So we also find in the South Asian community a lot of people suffering from this disease. So when you talk about the behavioral modifications, could you explain to us in details as to what the people ought to know? What are the symptoms, how they can come to know, and then again, what changes do they need to bring in their lifestyle?
Right. So one of the things about prediabetes is that people will not necessarily realize they have it. So it's important to be connecting with your physician, especially when you're in your 40s, to have yourself screened for this. Because as I mentioned before, it's your blood glucose levels that are slightly elevated. And so you might feel things like you're a little hungrier, you feel kind of tired, you might feel thirsty, you might notice that you're going to the washroom more, but you may not feel that that's much of a difference. And so you then are screened for it, and you're told that you have this condition. There is a number of things that you can do along the lines of lifestyle to help get your blood glucose levels back in normal range. So I just want to elaborate a little bit more about what are sort of the causes of prediabetes. So typically, some people, those that are higher risk, tend to be those who might be carrying a little bit of excess weight, especially around the abdominal region. You also, people who may not be exercising very much. Today's lifestyle is very much, we tend to be more sedentary, and so they may not be getting enough of the cardiorespiratory activities to help with their blood glucose control, and then also around diet. So we know in the Canadian population, there's a lot we could be doing to improve the quality of our diets. So eating less processed foods, those kinds of things. So those are the main things. Some other things to consider are, you know, how are you handling stress, especially during this time of the COVID-19 pandemic? There's been a lot of mental health issues that have come forth, particularly stress related, you know, people that may have lost their jobs, those kinds of things. So stress then causes cortisol release, so that's a hormone that then increases your blood glucose levels. So you want to try and find strategies that are going to help you cope with stress. So things like meditation, breathing exercises. Exercise is another one that can help with stress levels. It's also important sleep quality. So when we talk about sleep, it's not just about getting enough sleep, which it's usually recommended around 6 to 8 hours a night, but that you're getting quality sleep. So you want to make, so sleep quality means that you can easily get to sleep and stay to sleep throughout the night, and that you're going into a nice deep sleep so that you're restoring your body. So that's another component if you have prediabetes, making sure that you're getting good sleep quality. Now, I also talked a little bit about physical activity, just to go into that a bit more. So there's two types of physical activities that you want to engage in. One of them is cardiorespiratory activities, which help to get your heart rate up. And it's recommended for everybody that we get 150 minutes per week of cardiorespiratory activities. And it should be at a level that's considered moderate to vigorous. So that, as I mentioned before, is getting your heart rate up so that you're feeling it, right? You're feeling a little bit out of breath, you're sweating a little bit, and you want to make sure that each time you're doing it is for at least 10 minutes in order to get that cardiorespiratory benefit. The other type of activity that you want to be doing is strengthening activities, muscle strengthening. And that's because your muscles use glucose, and that's one reason you want to be doing it. And the other reason is that your strengthening exercises help to change your body composition to more of a lean body mass rather than carrying extra weight. So all of those factors together, if you're thinking about them, they also lead to better weight management, particularly physical activity and diet. And even like a 5% weight loss can make a big difference in your blood glucose control.
Mm-hmm. Interesting. So, Dr. Karen, your research interests are aimed at food and nutrition practices. Could you elaborate more on this particular aspect? See, general thinking amongst the people is that the diabetes occurs because of the excessive sugar that we consume. That's the only. But are there other factors also which lead to this? You have mentioned a few. So can you elaborate regarding the food and nutrition practices that we need to adopt in our daily life so that we can save ourselves from this?
Yeah. Yes, diet is quite important. When we think about diet as a risk factor, amongst the different lifestyle factors, it's one of the top ones in terms of preventing chronic conditions such as prediabetes, which then can lead to type 2 diabetes. So oftentimes people will think, oh, it's because I've been eating too much sugar that I got prediabetes. And that is not quite accurate. So it's not always about carbohydrates, and I'm sure you hear a lot about that. You know, it's a lot of bad press about carbohydrates. So it's really about the balance of your diet. So the balance between the three major nutrients, so your carbohydrates, your proteins, and fats. So let's start with the carbohydrates. You definitely want to avoid consuming a lot of simple carbohydrates. So that comes in the form of refined sugars that you'd find, say, in soda pop, in beverages like fruit beverages, that kind of thing, and baked goods that would have a lot of sugar in them. So you want to try to eat those very minimally, consume them very minimally. If you are going to have them, have very, very small portions of them, because again, you're just not getting much health benefit from those. What you want to emphasize when we're talking about carbohydrates, because you do need carbohydrates, you need glucose. Your body needs it as an energy source for the brain, for all your body cells, is that you consume more of the complex carbohydrates. So those are foods that have the sugar in them, so glucose and other forms, but it takes a while for your body to break them down. So you're not getting the spikes in the blood glucose after you consume them. So examples of complex carbohydrates are things like whole grain breads and cereals. Also fruits and vegetables, that particularly if you can keep the skin on the fruits and vegetables, because that's a really good source of fiber. Others would be pulses or legumes, so things like lentils, black beans. Those are really good fiber sources, and so they take longer to break down. As well as so other good fiber sources would be, again, going along the lines of whole grain sources. So making sure that you're consuming like 100% whole wheat bread. Brown rice would be another good example, as opposed to having white rice. So ideally you want to avoid the white flour kinds of foods, because those get easily broken down. So that's carbohydrates. Mm-hmm. Then we move into fat. So when we think about prediabetes, and insulin is what is needed in your body to help it handle glucose. So insulin is involved in glucose metabolism. It's also involved in fat metabolism. So there's a link there. Oftentimes we'll see if people have diabetes, they will also have cardiovascular related complications such as high blood cholesterol. So you want to also look at fats in your diet. You want to have more of the unsaturated fats. So those would be examples of foods that are fat sources that would be liquid at room temperature. So good examples are olive oil, canola oil, as opposed to having hard margarines that are more solid at room temperature and might have they're kind of more saturated, or butter or lard, which is solid at room temperature. So those would be examples of saturated fats. So your body more easily uses saturated fat to make blood cholesterol. So you want to not have so much of those in your diet, but more of the unsaturated fat. And then within the unsaturated fats, you want to make sure that you're getting the essential fats. So you may have heard the terms omega-3 fatty acids. Yeah. So those are an example of fats that your body absolutely needs. It's needed in your cell membranes. It's needed to maintain cardiovascular function. And examples of those would be flaxseed oils. Cold water fishes such as salmon are really good sources of omega-3s. Nuts such as walnuts and seeds. So you want to make sure you're getting lots of those. And unfortunately, in the Canadian diet, we do not get enough of the omega-3 fatty acids. There's also the omega-6, which are essential, but they don't tend to be an issue in our diet because we tend to get enough of those sources, examples being sunflower oil, safflower oil. Any kind of population studies that they've done on the food sources in the diet, we get more than enough omega-6. So it's really the omega-3 we need to worry about. Then there's the proteins, which is the other major nutrient. And you want to make sure that you're consuming lean sources of protein, and ideally more of the plant-based proteins. So when I say lean proteins, I'm talking about like chicken without the skin, lean cuts of beef, for example. Fish is another great source of lean protein. And then the plant-based sources, things such as tofu, your legumes, which I mentioned earlier, are also a source of fiber, but they're also an excellent source of protein. So again, examples of those are like lentils, your beans, white beans, for example. And then nuts and seeds are another great plant protein-based source. So again, it's not about just thinking about the carbohydrates. Think about the whole balance of your diet. Everything in moderation. Watch your portions, and you want to make sure you get a good variety in your diet.
Right. Okay, wonderful. And Dr. Karen, also with your research, is there any kind of research which shows Why is it that the South Asians are more prone to diabetes as compared to the rest of the population?
That is a really excellent question. And I know Vidhi, and she can talk more about this because she's explored
Sure, no
the
worries.
research on this, but I can talk very briefly about it. So when we think about diabetes, diabetes is a very complex condition. So there's a lot of factors that come into play, such as genetics, biology, cultural factors, social factors, psychological factors. Um, there's different theories out there as to why it's higher in South Asians. One is that there's some genetic differences that lead to how the body uses insulin and around insulin resistance. And so there's thought to be some differences there. And then it's not just about genetics, but also environment. So for example, when South Asians come to Canada, and that's where we're seeing the higher prevalence compared to Canadians, it's largely thought because of adopting our diet, our Western diet. So when you think about it, coming to Canada in itself it's a major transition, very stressful. So that's another contributing factor. And then then lifestyle can start to maybe come into play. So things around diet and maybe not being able to exercise as much. So it's very, very complex.
And one last question, Dr. Karen, is the focus of the CINI conference was towards an integrative approach towards chronic diseases. The amalgamation of the wisdom of the East and the modern science of the West, when they amalgamate, it can be wonderful for the people. What do you feel? How can these kind of conferences further help? And why is there a need to amalgamate both the sides?
Well, I think we need to recognize that we need to move towards more personalized, individualized care. So there's not a one size fits all for anyone, right? If I'm to go in to see my physician, I have different needs than, say, you or anybody else. And so I think that an integrative approach, really, I think of it as being more holistic and personalized. So it's really listening to what the person, where they're at in their behavior change. So are they thinking they want to make a change, and what are they willing to change, and how do they want to do it? So I remember when I used to work in diabetes care, so I worked for Fraser Health at Surrey Memorial Hospital, and I would see many different clients, and there was some, for example, that would use different foods that they thought were being beneficial to them in terms of their blood glucose control. So one example is bitter melon. I'm not sure if you're familiar with that. And so a lot of South Asians would use bitter melon to help, and that was sort of one of their traditional practices. So it's recognizing those sort of things that people find beneficial, and I see that as integrated care. And also thinking that, so integrated care to me is also about bringing in different health professionals. So again, when I think about when I worked in diabetes care, I mean, it's not just about me and telling you about, talking about diet. It's, diabetes is a result of many different factors, and there's different people with different expertise that need to come in and work with you to, to help you manage your diabetes. So it needs physician care, it needs nursing care, social work, physiotherapy, dietitian. And then some people will like to use other practitioners, physio being example. So it's really putting the person at the center and helping them to manage their condition in such a way that they are going to take action. So that's where I see integrated care being very important.
Wonderful. Dr. Karen Davison, thank you very much for your time, for this perspective. We would like to move over to Vidhi Thakkar now. Vidhi Thakkar has completed her PhD in health policy from the Institute of Health Policy Management and Evaluation. Vidhi also received a Master of Science in Experimental Surgery from McGill University and her Bachelor of Health Sciences honors at McMaster University. Vidhi was actively involved with the Canadian Association of Health Services and Policy Research and was also a board member for the Justice Emmett Hall Foundation. Vidhi currently works as a research associate at Kwantlen Polytechnic University on various projects such as the Mental Health Commission of Canada and CIHR COVID-19 Scoping Review and analysis of the Canadian longitudinal study on aging. She's also working as a postdoctoral fellow in patient-centered measurement research at Trinity Western University. So let's welcome Vidhi and learn from her about her perspective on this particular issue and how behavior change can make the changes and how we need to build our capacity. So Vidhi, for the next 15 minutes, the stage is with you. Carry on, and after that I can ask you the questions.
Sure, great. Thank you, Sinji. So just a little bit about, I know Karen touched on this early, but just to recap a little bit about prediabetes, it's a health condition in which the blood sugar levels, as Karen mentioned, are higher than normal. The likelihood of developing prediabetes begins to increase when a person enters their 40s, around age 45. And some people also refer to it as borderline diabetes, but that terminology is not really accurate. Instead, what people can think of is it's impaired glucose tolerance, which means your body is beginning to have difficulty managing the blood glucose levels in the normal range, particularly after eating. And so impaired fasting glucose means that the person is actually having challenges keeping their baseline glucose within the normal level that is needed for the body to convert that glucose into energy needs for breathing and for digestion. So having prediabetes is essentially a warning sign of an increased risk of developing type 2 diabetes. There are many causes of prediabetes. For example, the food that we eat that the body converts into glucose, that's generally done by an organ called the pancreas. So prediabetes, when that condition develops, it means that the pancreas is not really functioning normally. It's not able to make enough insulin, or more commonly, that the body can't use the insulin that the pancreas is making in a way that in order to move more of the blood glucose into the cells. So this condition is known as insulin resistance. Many contributing factors lead to prediabetes and are more prominent in the South Asian population. For example, lifestyle, low physical activity, being sedentary, sitting for long periods of time as opposed to good cardiovascular physical activity, which, as Dr. Davison mentioned, is recommended at least 150 minutes of moderate to rigorous physical activity. So individuals who may tend to develop more prediabetes can also have poor diet quality. And genetics also plays a big factor in terms of development of prediabetes. Women who once had gestational diabetes, which is a type of diabetes that occurs in pregnancy, are also at increased risk of prediabetes. So what are some of the signs of having prediabetes? It's very subtle signs. So people may feel more thirsty and hungry. There may be blurred vision or weight loss without trying. And according to research, it's shown that 30 to 60% of people who have prediabetes will go on to develop diabetes. Mm-hmm. In a Canadian study, it was estimated that 30 to 60% of the pre-diabetic population developed diabetes in 8 to 10 years. And so focusing on South Asians, compared to Western European immigrants, the study found that people who, for example, they looked at different age groups of South Asians, and South Asians between the ages of 20 to 34 were similar to Europeans who were almost 15 years older than them, 35 to 49 years, in terms of their insulin resistance and their glucose ability to use the insulin to convert the glucose. So this would suggest that South Asians are somehow more susceptible to developing these conditions at a younger age due to various dietary and genetic factors. And so in this case, we see nutrition is an important concept here. And I'm very much interested in studying prediabetes because it is a precursor to type 2 diabetes. I plan to analyze the Canadian National Longitudinal Study on Aging, which is focused on looking at a data set and considering the social as well as nutritional and genetic variables that lead to the development of diabetes. And we can also do a population analysis and an ethnicity-based analysis to see what part of that population is focused on South Asians in particular.
Mm-hmm. Okay. So again, like I asked Dr. Karen also, you have also touched upon this point. But what does research show? Why is it that the South Asians are more prone? And is it just because, as Dr. Karen just talked about, we moving over to a new place and not kind of adjusting to the system, but then the lifestyle, what we have over here, the fast-paced life, the eating habits change, and then for example, if you're from India or Pakistan over there, you were doing some kind of physical activity also, and the weather also was different, and that probably contributed to more sweat. Over here you're just sitting confined and you don't go out, don't exercise much, don't have the time for all that. So are all these factors responsible, or in the research do we find out something specific also?
Yeah, I think it's a combination of different factors: genetic, environmental, including ability to exercise. A lot of people, as you mentioned, the weather in India is better for outdoors activity and exercise compared to Canada. Well, in BC, we're lucky with better weather here, but in terms of the level of physical activity, could be more people are in India. And also, I think the quality of the food and the nutrition as well. So access to whole grains, fruits, vegetables, less processed foods, and less eating out, as well as this culture of cooking at home, cooking healthy meals together as a family, which is very prominent in the South Asian population. And I think really having knowledge of what constitutes a healthy nutrition and diet, and what constitutes not healthy food, is probably a good knowledge to have in that sense. But also it's a combination of factors.
Right.
A lot of people in the South Asian population, their relatives or their grandparents or parents had diabetes, and so they're more prone to getting diabetes. And so for that reason, you might want to make some lifestyle modifications or behavioral changes in order to avoid developing that condition.
See, a lot of details have been given to us in the Canadian Nutritional Guide, but hardly we follow that, the lifestyle that we have adopted, and that's pertaining to all Canadians. That fast-paced life where you're always under stress, tension to complete your work and to meet your targets, and then food is the least priority that you give. Whatever comes in your hand, you just put it in your mouth and that's gone. But how do you feel, Vidhi, with the kind of work that you are doing? The kind of messaging that is going out in the community, how much impact is that having? Are people really taking this seriously, or it's just that we hear and then it's just gone? That's the kind of approach we are adopting as Canadians.
Yeah. So I think that having a preventative and upstream approach is very valuable for our long-term healthcare, if we think about it. So for example, if we're looking at what would be most valuable, really considering access to high quality foods instead of fast foods, for example, or considering the nutritional value and quality of the food as opposed to just the timely access. In a fast-paced lifestyle, there are still ways to make plan meals in advance, or get people organized on the weekend when they have days off to be able to plan meals throughout the week, to avoid that kind of last minute rush if people have very hectic and busy lifestyles. So I do think that it is possible to plan and to be able to consider that you're doing this for your long-term health and wellness, and probably for the health of your whole family as well.
And Dr. Karen also touched upon the mental health crisis that is upon us. The chronic diseases are on the rise, but when it comes to mental health, that is another major issue. So how to look into that aspect also? And I would also like to know a little bit from you. Dr. Karen talked about cardiorespiratory activities, some of the activities that we ought to include in our daily lifestyle. Could you elaborate on these points, please?
Yes, absolutely. So research has shown that at least a half an hour of a brisk walk outside in nature, or bicycling, or any type of activity where you can really feel your heart pumping, you work up a small sweat, and you're really out there working your muscles, can help prevent lots of mental health conditions such as depression and anxiety and other mental health conditions. So exercise has a lasting impact on not only physical health, but also mental health. We've seen in the pandemic through our CIHR COVID-19 scoping review that there has been an increase in mental health conditions, in particular anxiety and depression amongst the Canadian population. And a lot of it has to do with their inability to go into gyms exercising, this fear of the pandemic and COVID-19, a lot of hesitancy around going outside and the spread of the virus. However, now that with people getting vaccinated and it is safe to go outside and take walks and go for a bicycle ride, I do think that participating in daily physical activity, at least a half an hour of a brisk walk, would be beneficial to the entire population, including South Asians.
Mm-hmm. And some recommendations from either of you as to how to be mentally strong, because as my question before to Dr. Karen was that amalgamation of the wisdom of the East and the modern science of the West, when they combine, this can produce excellent results. And that's what Canada India Network Society has been focusing upon since the past many years, that we need to incorporate these thoughts. So any practical recommendations by you as to what also, apart from the exercises and the diet, what do we need to inculcate in our life so that we remain mentally strong?
Yes, absolutely. I believe that mindfulness, meditation, as well as yoga would be great contributing factors in order to build resilience and mental strength as well.
Right. And Dr. Karen, we are finding that these things are accepted now, even in the medical fraternity also. And has some research been done? Because we hear from the people who propagate about yoga and other breathing exercises that medically also it has been proven it helps. So this is being accepted now. What do you feel? What more needs to be done?
So what more needs to be done in order, like when we think about alternative practices, like mental health? Yeah, I mean, it's things such as yoga has been very well researched. Sometimes some of that research doesn't always get into our system, like in the Western system. But there's been a lot of research, I know, in the Eastern systems around yoga, around acupuncture, around traditional Chinese medicine, Ayurvedic medicine. I think there needs to be more knowledge translation, knowledge dissemination around these practices, especially ones that will help with stress reduction. So yoga, it can, for many people, can help to reduce stress. Other people, it's mindfulness kind of activities, breathing activities. For others, it can be just kind of like doing biofeedback or tapping. There's a lot of different strategies that are out there to help with, people that are struggling with their mental health. As Vidhi had alluded to earlier, we did a research study this past year that was CIHR funded that looked at COVID-19 and people who were vulnerable to mental health. And what we found, there wasn't so much about talking about these kind of strategies that I just mentioned. It was more from the literature. We also looked at Chinese literature and North American literature. So there was more discussion about that there than here. And here it tended to focus on, access to mental health counseling, which is important. So, if you find that you are struggling with health issues, and we know, for example, depression is very common alongside diabetes. So if you have a chronic health condition, that you are, getting screened for depression and anxiety, and then getting access to those resources. The Mental Health Commission of Canada has a lot of resources that you can access. The Canadian Mental Health Association, a lot of great resources. And then if you need to go beyond that and talk to someone, then there is, digital means in which to do that with a counselor. So it's really being sure that you identify, yes, I'm struggling, and then reaching out, and there's lots of resources that are out there.
Vidhi, anything in conclusion you would like to add?
Yeah, I would just like to say that with the South Asian population in particular, there's lots of resources that are out there in the BC community in terms of access to yoga, meditation, mindfulness activities, and also great resources within the community centers. that people should reach out and connect with one another. And I really think that integrated health is when we have people really thinking in the future about their mental health and well-being as well as their physical health and well-being. And that comes when everything, like all parts of a person's life, is balanced. So yeah, and great. Thank you so much for this opportunity to speak with you on the show. I really appreciate it.
Wonderful. It was a pleasure having both of you, Dr. Karen Davison and Vidhi Thakkar. Thank you very much for your time.
Thank you.
Thank you. So these were our guests for today's program, Dr. Karen Davison and Vidhi Thakkar, who talked about how we need to become in charge of our own health and what kind of resources are available. There's no dearth of resources. You can Google them and you can find lots of resources. But we have to initiate that step that we need to come forward and start taking advantages of the services that are provided to us. And also we would like to thank Dr. Arun Garg from Canada India Network Society, who has initiated this process of making us meet these individuals who are experts in their own fields, who come and talk to you and share their wisdom with you so that you can be healthy. And also, you know that every second Tuesday of the month, I have Dr. Arun Garg with me as my co-host, and we have a special guest somewhere from the world who talks about health, and the focus is to educate you, inspire you, and to empower you. So thank you very much to all the viewers also for sparing your time and being a part of this program. We conclude today's program. See you soon. Stay healthy, stay safe, and enjoy yourself.